Hi, I am Stephen Montague, the Program Director for the Queen's General Internal Medicine Training Program. I wanted to take a few minutes to say hello and also provide some information about what our program has to offer. With virtual interviews, you'll not be able to see our lovely city, with Queen's Campus on the picture and Kingston General Hospital right here by the water. However, I will do my best virtually to give you a glimpse of what things are like here. The Queen's program, like all 16 programs across the country, are fully accredited 2-year programs, and we sailed through our prior accreditation. And historically, we have 3 to 5 trainees per year, and this year we're excited to offer 3 spots for CARMS 2022. Some details about our program. We have a state-of-the-art simulation lab which you will use within your academic half-day sessions, and here's a picture of some of our prior trainees doing a resuscitation. We also have a longitudinal clinic in our program where you are, in a supported manner, scaffolded up to act as the MRP. You follow up on blood tests, imaging. If a patient calls in with new concerns or for prescription refills, that goes to you. And you also look after scheduling the follow-up for the patient. And feedback about this clinic has been amazing. The fellows feel that this really empowers them to be excellent clinicians in the outpatient setting, which is something that often isn't a focus of core training programs. Here we also have a very rich academic half-day series. We cover topics in the medical expert role of POCUS, peri-op, obstetrical medicine, stress tests, but we also have a lot of non-medical expert topics such as being an educator, discussing marginalized populations, and things related to billing and professional practice. In addition to the academic half-day series, we have a wide range of educational opportunities that you can attend: weekly medical morbidity and mortality rounds, grand rounds, obstetrical rounds, 4 times a week noon sign-in rounds that have a free lunch, as well as a once a week Tuesday GIM rounds, which is also catered and is in the picture that you see before you. There's also monthly opportunities to talk about ECGs, POCUS, as well as rounds on infectious disease, and really you name it, there's tons of opportunities here. How trainees are evaluated: we use the CBME framework like everywhere now, but what's a little different here is we did it first and we do it really well. We found a practical way to implement the CBME framework that really gives individualized coaching and feedback to our trainees in a practical way. And to help navigate it, you have an academic advisor with you throughout the entire 2 years. Some specifics about our rotations. As a fellow, you will act as a junior attending, which really means by the end of the training you function exactly as the attending does. You oversee all the clinical care, the team management, as well as the education of the trainees. Through the 2 years, you'll do this with 2 blocks on a regular CTU, as well as 2 blocks on our short stay unit. We have a short stay team that covers emerge consults in the morning and only admits straightforward people to their team without disposition issues, which is a pretty fun way to do CTU. You'll also be doing 2 blocks of inpatient general internal medicine consults and 2 blocks of ICU. The 2 blocks of ICU, 1 block will be in a community ICU about 2 hours from Kingston in Oshawa, and you get tons of procedural practice and a lot of responsibility. And the other block is here at Kingston at an academic center, which is really complementary to the community one. There's also a block of obstetrics in Toronto. We get great feedback about our local obstetrical medicine teaching, but this block the fellows also highly praise. You get put up in a condo on Bay Street within walking distance to Mount Sinai. There's no call for the month, and you can really just immerse yourself in learning obstetrical medicine, which is a really expanding area of practice within GIM. There's a number of clinic blocks. One clinic block here focuses on obstetrical medicine and peri-op, and another one is titled Ambulatory Clinics, which is largely CHF, CKD, stroke prevention, and other chronic disease management. There's another test on stress tests, where you will be overseeing exercise stress tests, stress echoes, presenting MIBs, as well as reading Holters. Lastly, there's a community inpatient acute medicine rotation that's also set up in Oshawa, which leaves 13 blocks of electives/selectives, which is a huge amount of time that we will help you through. People will often pick rotations where they want to brush up on their skills, but they also often use this time to develop a niche for their own future practice. Prior fellows have developed a niche skill set in point-of-care ultrasound, in obstetrical medicine, in thrombosis, or have used some of this time towards a master's or for research, and some fellows have used this time to rotate through various communities to get a feel for what type of location and setting they want to practice in the future. About Kingston General Hospital, we have two sites, a KGH site as well as a Hotel Dieu site that are just a quick 10-minute walk across the park in this photo away from another. KGH is a quaternary care center. We offer quite a bit here. We have EVTs and TAVIs, of course dialysis, some transplant, and the way we can offer this, because Kingston's a pretty small town, is we have a huge catchment area. We include cities from Cobourg to Cornwall, which is really basically Toronto to Ottawa, as well as all the way up to communities along James Bay, where patients are brought down to our site if they need medical care. We have a very busy service, over 10,000 medicine admissions per year. And what is a little unique here is subspecialty care is often delivered on CTU. What this means is if someone has a Crohn's flare or autoimmune hepatitis, they come to us, not GI. If they have an autoimmune hemolytic anemia, that's us, not hematology. Or an ILD flare, it's us, not respirology. So on the general medicine wards, you really see a really wide range of medicine that makes you very competent in those areas. Of course, we still have the subspecialties supporting, but we are the MRP. Kingston in general is a lovely small town with about 140,000 people, and it is a university town. There's 25,000 Queen's students here from September to April, and we're also very close to Montreal, Toronto, Ottawa. All of them are within a few hours, easy to go there for a weekend. Most of our learners live on the waterfront within a 15-minute walk to work, and there are tons of festivals, outdoor activities with hiking, sailing, and we are known for having many walkable places to eat and drink. Our strengths here, we have an excellent clinical training. One of the unique aspects, in addition to the breadth of cases, is the acuity of cases. We have an open ICU, the Davies 4 ICU, where patients that need pressors, non-invasive ventilation, dialysis, lines, we do that. They still stay under medicine as the MRP, and you gain a lot of experience and competence dealing with these critically unwell, non-intubated patients. You'll also be part of a small division of about 20 internists. We all have offices on the same hall, we all know each other, and it's also where our fellows have a shared office. So daily we're connecting to touch base on cases, on research, on how the weekend went, and you name it. Our administrative support is also on the same office. They're friendly, always available, and you will have a secretary to help navigate patient follow-ups, paperwork, and communicating results as you see fit. We also have tons of social events, whether it's going out for axe throwing or laser tag or escape rooms. And now that COVID restrictions are easing, we're fully embracing the social events at once more. The flexible schedule that I mentioned before is also a huge strength to this program, and you really get individualized attention to support your success in whatever your goal is. Our prior trainees, about half go to academia, half community, and we support both paths equally. And our graduates have worked across all of Canada, and they've developed practice niches within their fellowship that include point-of-care ultrasound, obstetrical medicine, perioperative medicine, thrombosis, stroke. Many have research careers, careers in quality improvement, have developed niches in addictions medicine. So you name it, we can help support it. And there's such a demand for internists. Often in the PGY4, there's multiple sites reaching out asking if our high quality trainees can go there, see what their site is like, to see if it's an area they would consider practicing in the future. All of our trainees are part of our Queen's family. This is the graduates from last year, and we look forward to seeing everyone back in CSIM now that it's in person to reconnect with everyone. I will close with this aerial view of Queen's with once again KGH on Lake Ontario. Here's the park that we walk across to our other site, and these high-rise buildings are the apartments and condos that many of our residents stay at during their time here. With that, best of luck with CARMS, and I look forward to speaking with all of you more on interview day. Cheers.